Hi, everybody. I want to welcome all of you to our COVID Q&A. Can everyone hear me okay? Wave if you do. Awesome.
Yeah.
Thank you. Sorry, I was in the wrong Zoom room waiting for everyone to show up. But welcome. Thank you for being here and taking part of your day to join us. I am very thankful to introduce to you Dr. Ryan Harris and Dr. Jessica Briggs. I'm going to introduce Dr. Harris first. Dr. Harris is a general partner with more than 25 years experience in the healthcare industry. He has authored more than 25 peer-reviewed studies, and he graduated from the University of California, San Francisco, and received his medical degree. And he also has an MS degree from doing health research and policy. Dr. Harris, thank you for being here. Thank you for supporting us through this COVID pandemic, and thank you for providing us resources to make good, educated decisions from infection control protocol to facilitating information about the vaccine and the new COVID strains.
Dr. Tess, thank you so much. And I guess I'll start by saying thank everyone for being on the call, on this video call, and everyone's service over the past year. Like this, it's been a year and 2 weeks, and we've all been through so much and have been facing so many complicated decisions and tragedy and opportunity. And we have to learn in this life, like in the midst of that, how do we survive? How do we move forward? And we read the newspaper a lot, and we see what's going on the web. And frankly, you know, I read the medical literature pretty closely, and at the same time, I see both the medical literature and what I see in the news, and there's often a mismatch that's frankly too pessimistic about what we have going on here. Yes, there are a lot of people who've died. Yes, COVID is serious. And yes, these vaccines are amongst the best medical treatments we've almost ever had in the history of medicine. And we've developed them in a year. It's almost a miracle, and we'll talk about that. Just one more thing on myself, just to be clear. I work at the investment firm that invested in Onsite Dental at Norwest Venture Partners. And we're here to support the growth of this business and its ability to provide super high quality dental care to people all over the United States. And we're excited by that. And we're excited by each of your individual contributions. As part of one of the things that we've done is the sort of questions that Onsite Dental has faced, a lot of our portfolio companies have faced as well. And I was sitting there reviewing the literature. I'm like, I'm kind of good at this. I've done it, but why on earth wouldn't we have someone who actually knows what she is talking about help us out more so? And that is my way of introducing you to Dr. Jessica Briggs, who's at least in the top left corner of my screen. And Jessica is an infectious disease expert working at UCSF, trained at both Johns Hopkins and at UCSF, and has been paying she's both super smart and has been paying a huge degree of attention, as her whole department has, to the epidemic. And so we've been working with Jessica to deal with the questions as they emerge. And this, I guess one important thing is that any answer we give you today is going to be fundamentally dynamic. Things are changing all the time at a high level, and she may disagree with me, but there's a balance between the rate at which we're vaccinating and the rate at which variants are developing. And to the extent that we win that battle of the vaccination first, then having a escaping variant isn't something that we're going to be terribly worried about. To the extent it goes the other way, we could worry about that, but we're not today. So let me shut up and thank you, Jessica, for joining this call. And Johanna, are you going to ask questions? I may pepper them along. And then after this, if we don't cover questions, feel free. How many people do we have? We have 53. So maybe best to submit them in text to Dr. Tess, and then we'll work it from there. Oh, sorry, I'm going to say one more thing. Our agenda here with you is truth. We're going to tell it to you exactly as we call it, as we're seeing it in the literature today. We don't have any agenda, but but the bias is just truth, and the truth is the vaccine's kind of amazing. But I'll shut up.
Thank you for that, Dr. Harris. We really appreciate that and the support you provided us through this whole pandemic. I want to thank everyone who's reached out to me and submitted questions. I know we all have questions, and if you have a question, probably, a lot of other people out there. So thank you for voicing your questions and your concerns. We're all really working hard in making the right decisions for ourselves, our family members, our patients, and of course, our community. And, we are devoted to being in the healthcare field. So, we're also role models for others in the community. So I'm going to go ahead. I'm going to start asking Dr. Briggs some of those questions, and again, text me or use the chat room, and if not, I can get you the answers later. So first, we're going to start with questions regarding COVID. And the first question I have is: if someone is diagnosed with COVID, when can they go back to the workplace, and is this different for healthcare workers?
Right. So the recommendation is that people who have been diagnosed need to wait 10 days after their diagnosis. Plus, they need to have no fever for 24 hours and improving respiratory symptoms. But generally, this comes down to 10 days after diagnosis. And the reason is because they've done studies showing that when you take a swab, even if it's still PCR positive after 10 days, it's no longer at a high enough level to transmit to other people. So we don't even test anymore for clearance. We just say after 10 days, you're good to go back. That's true also for healthcare workers. There's no difference. We don't test doctors or dentists or anyone anymore. There's no testing required. If you are severely immunocompromised, so let's say you have like a lung transplant and you're on a bunch of immunosuppressants, that is a little bit different. And we often, wait 20 days before saying you're allowed to go back to work. But those situations are different, and those cases will be addressed usually by their doctor.
Thank you. I've gotten that question quite a bit. And originally, I should clarify, originally it was 14 days.
Yeah.
And that's how our protocol is currently written. So we're probably going to be updating the protocol soon. It's been very fluid, and now it's been a year and 2 weeks. So we have a lot more data
Exactly.
to make our decisions from.
And this also comes up because full quarantine is still 14 days. And it's confusing because you can think like, why, well, if you're exposed, why 14 versus, because it might take up to 14 days to get sick. But once you are sick, we know that you're no longer infectious after 10 days. So that's sort of a difference.
Great. Dr. Briggs, how worrisome are the long-term effects of COVID? I know that people have heard of the CEO of Texas Roadhouse recently committed suicide as a result of some of the sequela of his COVID infection and the long-term side effects. It's been hitting the news everywhere. Tell us a little bit more about that, and how common are they?
Right. So this is a syndrome that's sort of been termed long COVID in the literature, right? And so this is people who continue to experience some symptoms of their illness even beyond 4 weeks. So where it sort of becomes chronic at that point. And those symptoms have quite a large range. Like the most common are fatigue, weakness, and shortness of breath. But people report, of course, losing their sense of smell or taste and not being able to get it back. They're ringing in the ears. There've been some reports of brain fog. And so those things are quite concerning, and they happen in a not small percentage of people. So somewhere probably between 10 to 30% of people end up with some symptom for more than 4 weeks. Now, how long those things last ultimately, I think is still up in the air and is actively being researched in cohorts of patients. But, while some people are like, oh, this disease, it just seems like a small cold and I'll get over it, it'll be fine. There is some risk, right, that you'll be in that 10% that have long-term effects. And you certainly don't want to put yourself at risk for that if you can avoid it. And that's certainly one of the reasons I was most excited to get vaccinated, because heaven forbid I have overwhelming fatigue for a year. That doesn't sound very fun at all. Even though I'm young and theoretically I would normally be fine. So I think that the long-term side effects are concerning. And I think that in general, in the medical field, we've known that viruses can trigger syndromes like this for a long time, but we've been really unable to understand how they do it and why. And now that we have this pandemic where it's one particular virus that we know is causing this particular syndrome in a lot of people, I think we're going to get some answers finally as to what is happening, like why some people are prone to developing these long-term symptoms and others aren't. And so it's a big opportunity to learn more about that. But overall, these symptoms can be really, really concerning and also very difficult to treat, because we have these post-COVID clinics where people come in and they tell us what's going on, and we still don't have a lot of things to offer in terms of treatments for the longer effects. So avoiding them, in my opinion, avoiding infection and avoiding them would be the way to go.
Thank you for that. How are the new strains different from prior strains, and why do new strains keep developing? I heard we have a New York strain now as well.
Yeah. So there are a lot of different strains at this point. There are two possibilities for the way that they can develop, basically. One of them is that in immunosuppressed people, like I was talking about earlier, who have trouble clearing the virus can stay in their body for a long time and go through a lot more mutations than it normally would as it travels around in the world. And so there is some evidence that some of these strains arose in immunocompromised people who were infected for long periods of time and then got a lot of treatments, which would be like a lot of selective pressure on the virus, and cause these variants. And then once the selective pressure makes them more transmissible or gives them some other advantage, then they sort of take off in the population. There's also the possibility that when there's enough virus in the population, natural mutations are occurring. And again, there is selective pressure for the virus to want to transmit. And so you can also have evolution of the virus towards higher transmissibility just from having a lot of infection out in the world and just the virus getting quote unquote lucky by mutating in a certain way that is advantageous to the virus. A lot of these variants have things in common, like certain mutations in common that make them either more transmissible or better able to avoid the immune response. The good news is that so far, the vaccines seem to be quite effective, specifically versus the UK variant, which is becoming the dominant variant in the United States. It's called B1117. That is a much more transmissible virus, at least 50% more transmissible. But we do know that the Pfizer and Moderna vaccines are incredibly effective against it. There's just more and more data coming out of the UK showing that they're holding up very well against that variant. The only variant that we have some evidence, that the vaccines will work a little less well is the South African variant, the B1.351 variant. But even that, when I say less well, I just mean, going from 95% efficacy against, actually we have real data from J&J, right? So it's like 72% effective in the US, where the South Africa variant doesn't really exist much yet, versus 64% effective in South Africa. So that's, that there's still a lot of protection to be offered from these vaccines. And most importantly, right, that in the J&J trial, there were no deaths in the vaccine arm, right? So it's still 100% effective against death and very effective against severe disease as well.
So Jessica, let's spend a second on that, because I think this is a super important distinction, because we hear in the popular media about, it's X% effective. We heard AstraZeneca may have overstated by a few percent how effective they are. When you said, you said, talk about the distinction between death and hospitalization versus overall effectiveness and what you're seeing. Pick any one of the vaccines, just so we can see the difference and explain what that and contextualize that.
Well, the Pfizer and Moderna trials were completed before any of these variants were out there, right? So we know that the 95% number for effectiveness in both of those trials, that's against any symptomatic disease. And they were both 100% effective against death. And I think Pfizer was 100% protection against severe disease, and Moderna, there was one case of severe disease. So 97% effective. Johnson & Johnson, it's a more interesting trial because they had different arms in different countries. So when you talk about the, efficacy against any symptomatic disease, and you hear the number 72% in the United States, that's the J&J number for the United States. And then in South Africa, it was 64% effective against any disease, but 100% effective in every arm of the trial against death, and 85% effective against severe disease across all 3 sites. So, these are still working very, like the Johnson & Johnson vaccine is still working very well, even in places that have the South Africa variant and other variants. And the in vitro evidence for Moderna and Pfizer is very encouraging as well, that they're going to still be quite protective against the variants. And the real world data is also encouraging, right? So as you look at countries like Israel that has vaccinated a large proportion of their population, as you look at, there's a lot of studies that have come out of, because healthcare workers got vaccinated first, you can look at declining infections in healthcare workers in several different places in the UK and in the US. A bunch of studies came out like last week, and it just shows remarkable effectiveness of when people get vaccinated, they just don't get sick anymore. So that's really the big takeaway.
So, and to me, I always found that super interesting. The fact that, they say, oh, well, J&J in the 60s% effective in South Africa. But even in South Africa, which has the variant for which we're all most concerned about right now, it's 100% effective against death, and some use of greater than 85 in terms of severe disease. The reason we shut down as a society is because of death and severe disease, not because of flu-like symptoms. It's that changes everything. And that's why, at least for me, I'm super optimistic that if things stay the way they are, getting vaccinated as a society, as we move towards more and more vaccination, we can both be safe and have fun again.
Right. I think we're all looking forward to things getting back to normal. I mean, all of the data, even in the United States, is really, really encouraging, right? Cases were dropping really quickly in February, and they've sort of plateaued out. There are certain places like in Michigan where it looks like, the UK variant, the more transmissible variant, is picking up. But again, those cases and those hospitalizations are occurring in people that have not been vaccinated. They're occurring in the younger populations that haven't been offered the vaccine yet. So really, we just need to get everyone vaccinated as quickly as possible so that we can just drive this thing down to where we can open everything back up again.
So on that point, you mentioned the different variants and different strains that are developing. What can we do to stop the virus from evolving further?
I mean, the best thing that we can do is just get the largest proportion of the population vaccinated as quickly as possible, right? I mean, that is the true herd immunity means that so many people are vaccinated that the virus literally peters out and it can no longer transmit at all. I don't think that's necessarily what we're going to reach with this epidemic. I think this is going to become more of like a seasonal disease. But the point would be to have so many people vaccinated that there aren't that many people that are still vulnerable and can transmit. And the only way to do that is to get our rates of vaccination in the population up, hopefully above 70, 75%, because it's a very contagious disease. And that's really the goal. So it's not just our country too. We need to vaccinate people, and it's like sort of a worldwide challenge. But I do think that it's been incredibly encouraging watching, like, I think 2.5 million people are getting vaccinated per day right now in the United States, sort of an epic effort. And we've seen already big benefits from that, right? Like nursing home deaths have plummeted. People are allowed to go visit their families in nursing homes again. And this is just going to keep happening. As more and more people are vaccinated, more and more things are going to go back to normal.
Regarding vaccines, is there one vaccine that's better than another? And to that point, should people wait to get a specific vaccine?
Yeah, you can't really compare. The only two that you can compare head to head are like Moderna and Pfizer, because they were trialed at the same time, and that when the same like the old variants were around, and they're practically identical in terms of how effective they are. 95%, both of them. There's no difference. I mean, it's like flipping a coin, right? And then it's hard to compare those two directly with J&J because J&J had to go up against more of the variants, right? And so if I were given the option to get vaccinated, I would be just give me whichever one is available, right? Like I don't consider any of them to be superior to any other one. I mean, the nice thing about J&J is that it's one shot, and then after 28 days you're protected. Some people like really prefer that, but you don't always get to choose. And I don't think there's really any big difference between them at this moment. There's definitely no difference either in sort of like adverse events or safety. They're all very safe and they're all very effective.
And I should mention, because I know this from personal experience, J&J actually is conducting 2-shot studies as well. So, we're also learning, and, like Dr. Briggs said, the best thing is to have the vaccine that's available to you. Now, what do we say to those people who have had reactions to the flu vaccine or to other vaccines in the past?
Right. So the only contraindication to getting one of the vaccines is to have a known allergic reaction to some component of that vaccine. And so if you know that you're allergic to something in the vaccine, then you shouldn't get it. Otherwise, though, like food allergies, any other like random allergies you have should not hold you back from getting the vaccine. In terms of allergic reactions to the Moderna and Pfizer vaccines, they're at the rate of about 10 people per million. So it's extremely rare. They do make you wait like 15 minutes after getting your shot because these anaphylactic type reactions tend to happen quite quickly after exposure. But 10 people per million is very low. To compare to the flu vaccine, that's about 1 person per million. So there are a few more, allergic reactions with these shots, but overall it's still extremely rare and very safe.
And I think it's important also to differentiate side effects, like the short-term side effects that people might get after the vaccine, which just means that the vaccine is working through your system, versus an allergic reaction. I mean, feeling tired, feeling achy, those are just common side effects that are short-term that typically will last just a couple of days, correct?
Right. Yeah, they're actually, especially the mRNA vaccines, they tend to be quite like reactogenistic, which means like you just have some reaction somewhere, like sore arm, maybe some people get a rash. Personally, after my second shot, I felt like I had a fever, like a genuine fever, but it lasted 12 hours, then it was gone and I was fine. And it was a lot better than having like a 10-day course of COVID. So there are some side effects to the vaccine itself, but yeah, I wouldn't consider those to be like true safety worries.
And what do you say, Doc? I just got this question. For women who are pregnant, is it safe for them to get the vaccine while being pregnant?
Right. So pregnant women were not, studied in these original trials, although some people did become pregnant while enrolled in the trials. So it's very low numbers. It was like 12 or in the Pfizer trial, I think there were like 8 in the Johnson & Johnson trial. And no adverse events were recorded in those pregnancies. And now we know that the NIH has said that at least 10,000 women, they approximate pregnant women, have gotten the vaccine with no known reported side effects. So I think right now it's very much a personal choice. We don't have the kind of like clear study data that we have on like for non-pregnant people. On the other hand, like every physician that I know who is in some sort of COVID type exposed environment has chosen to go ahead and get the vaccine, both because they want to protect, themselves, because getting COVID while pregnant, you're at higher risk, right? And second of all, then you make antibodies that you pass to your baby, which actually there was just reported a couple of weeks ago that does happen. So the baby, like the baby gets some good antibodies too, right? And there have just been no, even though these 10,000 pregnant women who got the shot outside of the trial, they don't have like formal reporting. There are ways of reporting adverse events that when you're not enrolled in a trial through the CDC, and nothing has been reported. So I consider it safe. And with my friends were to ask me, I would say I would definitely get it. And I have told several of my pregnant friends to get it. So that would be my advice. Yeah.
Thank you for that. So in dentistry, we have reported very low numbers of infections. I think that the ADA came out, and I think they said 2.7%. And so, some of what I'm getting from, from people in our company is, what I'm doing works. It's worked. I'm using the PPE, I'm social distancing. Why should I get the vaccine?
Well, I think there are two answers to that, right? I mean, first, there are these more transmissible variants happening there. While your risk has been low thus far, it does not mean that you're going to be safe forever. Yeah, I think it's just thinking about personal protection and being able to have that, like, oh, I'm safe now because I've got the vaccine. That's one aspect of it. And then the other aspect is just the societal aspect of it, where like we were talking about earlier, whereas if we can get as many people vaccinated as possible, as quickly as possible, we'll hopefully stop having so many new variants develop, and we'll be able to like reopen things and get back to like more normal lifestyle more quickly. I would like to reassure everyone that I think that the speed and the trials just happen very fast, and people get very worried about like, oh, were things rushed? Like, were corners cut, right? Is it really safe? Like, there's people are like kind of suspicious, like, is it really safe? And what I always tell everyone is that these trials were actually the same size that would be required for a trial of any other vaccine. It's just that there was so much COVID and so much transmission that it's easier to hit the required endpoints for a number of infections to end the trial much quicker. And so just, to give you some numbers, there were 15,000 people per arm in the Moderna trial. There were 18,000 people per arm in the Pfizer trial, and 22,000 per arm in the J&J trial. So massive numbers of people, right? And now we have millions of people in the United States that have been vaccinated on top of that, right? And so that's just the numbers. And then we have, the FDA requires at least 2 months of safety data because most vaccine-related adverse events happen within 6 weeks after vaccination. So, all three of those trials had to wait until everyone, all 22 or 40,000 per trial had 2 months of safety data, right? And now we've got even more than that. We're coming up on, 8 months to almost a year of safety data for some of the trials. And so we have a lot of data now, and we have a lot of reporting, and there really have been no serious adverse events reported. And the other thing that people worry about is this like newer technology of mRNA, right? That like they've never heard of an mRNA vaccine, that we have not really had a big mRNA vaccine before. And while it's true that there has been no like large scale mRNA vaccine before, these types of vaccines have been in trials for years. And there was like a review paper on them in 2018 talking about how they were trying to develop one for rabies, one for Zika. And they've actually been used in cancer trials for sort of a different mechanism for cancer therapy. So even though like the public at large hadn't heard much about mRNA vaccines before, they have been trialed in humans successfully and safely for years before this pandemic hit. And it just so happened that this technology is the one that you can use the fastest to develop a vaccine in the quickest amount of time. And it's sort of the perfect like platform for a pandemic vaccine.
Thank you for that. So we have a couple of questions in the chat. Would you recommend to take an allergy test beforehand to see if we're allergic to anything that could possibly be in the vaccine?
No, I don't think so. I mean, first of all, I'm not sure that there are even like easily available allergy tests for the ingredients in the vaccine. But second of all, again, the anaphylaxis is so rare, right? Like 10 per million, that it would not really make sense from a statistical standpoint to get tested. If you have a history of anaphylaxis and you don't know to what, that would be a sort of more interesting question. But most people who have a history of anaphylaxis, they know what it's from because they ate something or and so in that case, you would know what it was. And so I think there are very, very, very few people who know that they have an allergy to something in one of these vaccines, and those people probably already know.
So I'm going to shift a little bit now to post-vaccination questions. We have had a significant number of our team members get vaccinated. And I've gotten this question in different forms. If I'm fully vaccinated, can I pass COVID to my kids, to my elderly family members, or to other people who have not been vaccinated or refused vaccination?
Right. So all the numbers we've been talking about in terms of the efficacy of the vaccines is in preventing symptomatic disease, right? And the big trials did not initially look at can you still get infected after vaccination? And then, of course, if you're infected, can you transmit after vaccination? And it's a big question. But more and more, we're having like good real world data that the vaccines not only prevent symptomatic disease, but they prevent infection from the virus. So it's not as good at doing that, but it's pretty, at least Pfizer and Moderna, which is what we have the best data from so far, seem to reduce your ability to even get infected at all by 70 to 90%. And so that means, of course, if you can't get infected, you can't transmit, right? And so overall, these vaccines so far also seem to be quite effective in reducing transmission. What that exact number is, like how good they are at reducing transmission, is still yet to be determined, for each vaccine, but they're quite good. So my answer would be, once you're fully vaccinated, while there is a small chance, right, that you could still get infected, because I'm not saying that the vaccines are perfect, right? There is a small chance you could get infected, and an even smaller chance you could transmit, because there's some data that it lowers viral load in the nose as well. So even if you are infected, you have lower viral loads. But so it's small, but it's still there. But in general, right, the CDC is saying if you're vaccinated, you can hang out with unvaccinated people from one other household, right? And do that completely safely. And that's what I have been telling people as well. So like hanging out with one other person, you're protected. You're also protecting them because you're probably not going to be able to transmit. And there you go. You're allowed to hang out with unvaccinated people. I think that it's just a really, really good vaccine, to be honest. Like we sort of hit a home run with these vaccines in terms of how efficacious they are. And while we're still gathering data, the real world data just looks better and better.
So on that point, I'm getting asked, why do we still have to social distance and wear masks if we're fully vaccinated?
Yeah. Well, I think that, again, we're trying to there is still a possibility, right, that you can get infected and you can transmit. But overall, I think it's more you're looking at the societal level, right, than the way of doing things, right? Because not everyone is vaccinated yet. And we should all be still doing our part, right, to mask up and social distance in situations which we don't know the people around us, like at the grocery store, where we're not, as familiar with who they've been hanging out with, in order to decrease transmission further, right? So that we can just vaccinate everyone as soon as possible, decrease transmission even further, and get back to normal. It's more about the societal level at this point, more so than the individual protection.
Jessica, do you hang out with vaccinated friends indoors now?
I hang out with vaccinated friends all the time indoors, and I hang out with unvaccinated people from one other household also indoors now. All the time.
So you're saying if you're in a room, there are 5 friends, you're all vaccinated, no one wears masks.
Yeah.
If there's a 6th friend who's unvaccinated, you're cool with that as well?
Yes.
Without a mask, because there's a window of protection around them. Is that the logic?
Basically, yes.
Got
in
it.
fact, that's a very good way of putting it. I actually have a group of 6 friends. 5 of us are vaccinated, 1 is not. And
we didn't prepare this part of the conversation.
and we're like, oh, well, Ashley's protected by the rest of us, so it's, yeah, that's true.
So I'm just going to highlight that even with teens currently who are fully vaccinated, you're still to continue to follow our protocols of social distancing. It is the light at the end of the tunnel, but the more people are vaccinated, the quicker we can get to being able to do the things that we all miss doing, and going back to hanging out without masks and all that good stuff. So of course, just to make sure, guys.
I work in a hospital, right? And we're all vaccinated and we still wear masks. So yeah, and social distance. So there are certainly occupational things are quite different from what you're doing individually at home.
Yeah, people get very excited about these things nowadays.
Yeah.
Okay, so some follow-up questions for that. So if I'm fully vaccinated, do I still quarantine after an exposure, and if so, for how long?
Yeah, so actually the CDC says that if you're within 3 months after vaccination, you do not have to quarantine after an exposure, which is amazing. So again, that means they really think that these vaccines work, right? So no, you don't. You don't have to quarantine if you're within 3 months after vaccination. And I suspect that that might be extended to 6 months based on some data eventually, but right now it's just 3 months after vaccination.
So if someone is partially vaccinated, so they just got 1 out of the 2 shots and they got COVID afterwards, do they still need that second shot?
Yes, the answer to that would be yes. You know, you would need to wait until you were fully recovered from COVID to get that second shot, but you should definitely get the second shot at that point because it will boost, you know, both the shot and the immunity you get naturally. What needs to be boosted to the highest level, so that your protection is on par with other people that have gotten 2 shots.
So if I am partially vaccinated and I get flu-like symptoms or COVID-like symptoms, do I still test?
I would, yes, because symptoms are different, right? Like exposure, but you're feeling fine and you're vaccinated, that's fine. But if you have symptoms, I feel like you should get a test. It's likely to be negative, but just to rule out that possibility so that you know whether or not you need to be quarantined at home.
And if you're fully vaccinated, would you still test?
I would, yeah.
Okay, great. So we have a couple of more questions in the chat room, but those are all the questions I had as far as the questions that were submitted. So once you have the vaccine, it's been over a month, is it still recommended to wear an N95 or level 3 mask or level 3 mask will be sufficient when aerosol is produced? So this actually goes to the level of protection. Right now, the OSHA standards have not changed for their recommendations, and their recommendations is, you know, that to wear the highest level protection, which is N95, based on the amount of aerosol that's expected from the procedure that you're doing. So the OSHA standards have not changed, and honestly, based on previous experience, from what we've seen in the industry, I think that they're not going to change. We're going to probably stay with the higher level protection for aerosols. Would you be comfortable taking the J&J vaccine knowing that its efficacy is 74% or so, Dr. Briggs?
Definitely, I would. I mean, that's, you know, again, that's the overall number, but it's 100% effective in preventing death. It's over 80% effective in preventing severe disease. And remember, it was trialed at a different time. It was trialed when we had all these more difficult variants, right? And so if we had a real world situation where we could try Pfizer and Moderna directly versus J&J, the Pfizer and Moderna ones might not look 95% good anymore, right? So just keep that in mind, because the numbers were created during different time points, different parts of the timeline. And I would be totally happy with getting the J&J personally.
Great. Do you think we're going to end up taking the COVID-19 vaccines yearly with boosters like the flu shot?
Yeah, I think that depends on a lot of things that we're still learning about, right? On the rate of mutation of the virus, and if these new concerning variants keep coming up, and if one comes up that is much better at escaping the vaccine than any we know of so far. I mean, I think Pfizer has already developed a new modified spike protein that they're trialing against the South African variant. And so, you know, I think we could see a situation in which there new variants arise and we have to get these shots either every year or every 2 years, sort of to keep up with the mutations like we do with the flu shot. But that is difficult to really predict right now as to whether we're going to have to do that in the long run.
So, Dr. Briggs, I don't know how you feel about answering this question, but do you think that health clinics will start advertising to their patients that their teams are fully vaccinated?
Like in terms of saying that, like,
they're doing that now. Just to be clear, I see it now. I don't know what you guys see. I see other dental practices. I see other primary care practices saying, yeah, everyone's vaccinated. I see that. I mean, Jessica, feel free to answer. I mean, it's happening.
Yeah, I do know that doctors, patients are asking staff when they come in, are you guys all vaccinated? So I know that that's something that patients are asking about. You know, are you guys all vaccinated?
Yeah.
But how do you feel about that, Dr. Briggs? How do you feel about marketing or advertising that a whole team is COVID immune, I should say?
Yeah, I mean, I want everyone to get vaccinated. So I think it's great when entire clinical teams are vaccinated, right? Like I would fully support all clinical teams being vaccinated. And it's not surprising to me that people would try to use that, you know, in advertising. Because the vaccines are still technically under this emergency use authorization, I think you can't force people to get vaccinated right now. But I was looking this up today, and actually it looks like Pfizer and Moderna are going to file for like permanent approval in April, and that will probably be granted by the end of this year. So, you know, these vaccines are going to be off emergency use authorization probably by the end of this year. And then I think you will start to see places maybe require it for their employees, and then you might see an uptick in advertising as well.
And do you think that these vaccines are going to continue to be provided free at that point, or do you think that it's likely that people will start charging for them? I mean, usually there's some sort of a copay for the flu vaccine. I don't know if it's $25 or $20, but there's usually something that you pay to get the vaccine, right?
That's a good question. I suspect that eventually it will go sort of back to like how the flu vaccine works, right? And be something that your insurance mostly covers, and then maybe with a small copay. Like, I don't think we're going to have these massive vaccination sites. It's a lot of effort and it's a lot of organizational difficulty for institutions and states. So I think this will eventually become something much more routine and much more like the flu shot, and there probably will be some small costs associated with it.
So I've seen a lot of states, you know, my state of Arizona, where just a couple of days ago, everyone 16 and over is now eligible to get the vaccine. I'm seeing this more and more around the country. And I really believe that part of the reason is because, you know, I think our leaders have realized the urgency in really trying to stop this horrible virus from evolving and mutating, and these strains really just disrupting our lives as our lives have been disrupted in the last year. Those are all the questions we had. Thank you so much, Dr. Briggs, Dr. Harris. We really appreciate you. We appreciate your leadership and your guidance. And thank you all in the front lines, everyone, for attending this Q&A. You know, we know these are really, really, really difficult decisions to make. You know, we have really tried to educate and empower everyone. We know that everyone's situation is different, but we really feel strongly that these vaccines provide safety for you, for your loved ones, for the community, and for just the world. Really, we're talking about the whole world here, struggling to really get back to, you know, a level of normalcy where we can interact with each other and not be concerned about having to wear masks or social distancing. You know, we have seen the impact of these vaccines directly on the data. I mean, you can look to the, you know, John Hopkins has a wonderful website. I'm sure, you know, every state also has websites, and you can see how the vaccination campaigns have really impacted, you know, the transmissibility of this virus, and you know, the decreased significantly the number of people who are dying from the virus. So please feel free to reach out to me, Stephanie Greenlee, when all of us are here to support you. Thanks again for everything you do every day to make the lives of our patients better. Take care. Thank
I'm
you.
Sorry to interrupt. This is Ern. Wanted to just add a couple more things to reinforce the messages here. First, I want to say thanks to you for making this happen, to Ryan Harris for all of your support, and to Dr. Briggs. But I want to just offer from a non-clinician, non-scientist point of view. I'm your CEO, but I'm not an expert at this. Yet I am very confident in what I'm hearing from Dr. Harris and Dr. Briggs. So why is that? What gives me confidence? So I look at people's track records over a period of time. And Dr. Harris has been very level-headed and realistic, and at times even pessimistic about how COVID would develop. From the very beginning, when some experts were saying we'll shut down for 2 weeks, Dr. Harris said, I don't think so. I think this is probably going to last, 6 weeks, could be 8 weeks. And as things evolved, he said, I think it's going to be longer still. When many people started to express optimism during last summer, Dr. Harris said, let's not get too confident. I think there's a good chance there'll be another surge. So at every step of the way, when many people wanted to be optimistic, Dr. Harris was realistic. And what he believed would happen ended up happening. So now we hear optimism, and Dr. Harris has chosen Dr. Briggs, who is one of the most knowledgeable people in the world about this topic, not just in California, not just in the United States, in the world. So we hear this data, and we hear, and we know of a track record of being accurate and realistic, not overly optimistic about this. And so I think there's every reason to have high confidence in what you're all hearing today from Dr. Briggs and Dr. Harris. And I just want to, again, strongly urge all of you to get vaccinated. This is the best thing for yourselves, for your families, your friends, your coworkers, your patients who are asking these questions now with more regularity, and they do have choices of where they go see a dentist. So please take these expert opinions and expert advice to heart, and encourage those of you who you work with, your family or friends, to get vaccinated. Thanks, everybody.